Okay. Is my slide visible?
Yes, ma'am.
Yeah. Good evening. So, continuing with the previous sessions, I think Dr. Suman had yesterday discussed about how we go about establishing of a waste management systems. I'll be talking in little more detail of what she discussed. We have managerial and administrative aspect in one of your modules, I think, which look at systems approach. Who are the personnel involved in healthcare waste management? What is the evaluation and waste audit? I think Suman has discussed yesterday, and waste management committee. In integrated infection control, we have what is hospital acquired infection, what are the principles of infection control, what are the precautions we need to take while handling waste, and safety measures for waste handlers. And in disinfection and transportation, we have the principles of disinfection, how transportation has to happen within and outside the healthcare facility, and proper waste storage. And last component is the capacity building and training and monitoring. Here, what is the content of syllabus? How do you plan your trainings and role of WHO? And I think planning of training, I think Suman will be handling in the next coming classes as well. And systems approach, so basic principles to set up healthcare waste management in place. I think yesterday, as we Suman has discovered, we have to conduct a waste audit, minimize the waste, reduce waste wherever possible, and recycling in place. Identify the point of generation and start segregating from that point of source, and compile the inventory of waste and disinfect and plan your waste transportation and final till the final disposal, and keep occupational safety in mind, and continuous monitoring of the system and training of staff. So, what is important? How do we go about assigning job responsibilities for waste management? Is very important. Each one of us have to know what is our responsibility. We need to have separate human and financial resources. We need to have separate budget. We can't just say this is waste and we do not want to have any money. We need to keep separate budget for keeping your bins, trolleys, liners management, and disinfections and autoclave process as well. Because on site we have to do autoclaving, and have policies in place which reduces waste minimization. I have green purchasing policy, and good stock management practice, so that they do not land up in expired medicines or equipment or whatever it is. And implementing safe practices in relation to handling, storage, transportation, and treatment and disposal. Now, who are the categories of involved? We know everyone is important, as I told, from the hospital managers till the administrative staff, doctors, nurses, cleaners, class 4 employees, waste handlers. So, you can see that all of them are important and all of them have a responsibility to play, which we will discuss little later. And evaluation is one of the important thing we must keep, because we need to see how we are progressing as we implement a system. We need to see how we are going forward. Have we achieved what is done? So what is evaluation? It's basically a method to determine the degree of success in achieving the predetermined objectives. So it can be against the accepted criteria and interpreter of relationship amongst them. So, why evaluation? It's important to see the interest of the hospital care, ensure that hospitals are safe and providing medical services to patients, and to identify any shortcomings or inadequacies where we can improve upon, and to provide authorities a sound appraisal system. So, when come management and administration are two different things. Management is more looking at uh, planning, organizing, staffing, the whole of the process of management we look at as an administrative thing. Administration could be one on a day-to-day affair what we are looking at. So, what to evaluate? You can look at structural evaluation to see if you want to see your systems are working in your place well. You can look at structural, whether physical facilities are there available as required for waste management. Do we have adequate personnel? Do we have adequate finances and materials? And are there process and procedures in place? And how well they are doing, and whether the people are using PPE, whether they're following whatever SOPs we have put in place. Okay. And content also, you can see what is the actual plan and how it has come down, and how come you can look at how many needle stick injuries as this come down, or what is the hospital acquired infections as it come down. So these are the outcome you can measure. And impact overall for the community. Is there any hazard from our hospital waste which is causing, or as an hospital also you can see whether our outpatient is increasing, based on our, this is one of the component, right? Even in your kayakalp you have seen that this waste management is one of the important part of evaluation. Any questions still here?
No, ma'am.
No, right? Okay. So, what are the stages of evaluation? We set out with questions and look out for sources of information from where we can collect the data, then obtain the information, and then this information can be done by either external agency or by yourself or some service providers. You can ask the common treatment facility to evaluate us. Okay, so usually this evaluation can be conducted by infection control committee or the waste management committee itself. Coming to the, I think all of your hospital will have infection control program. This is also one of the administrative requirement which needs to be there. What is the program? What is the? I think you all know this. It's basically looking out for surveillance of hospital-acquired infection, outbreak investigation and control measures, occupational health and safety measures, and education of safety, antimicrobial policy, and engineering control measures. So for this, you need to have different policies in place like standard precautions, isolation practices, hand hygiene measures, disinfection, housekeeping and biomedical waste management, laundry and linen, and kitchen and food hygiene. So you can see that biomedical waste management can be a part of your infection control practice. I think you all are aware that we have a hospital infection control committee in major hospitals. Usually, will be headed by the hospital administrator. We'll have members from senior doctors, microbiologists, and matron, blood keeping. Also, engineering services also should be there. So, as I was telling, biomedical waste management committee can be a part of hospital infection control committee, or it can be working independently. So, what is the role of HICC? Just to highlight the points, to set up infection control program, to formulate simple, effective, practical policies, and to develop infection control manual. I think many of the hospitals are going in for NAC audit, NABH audit. These are all mandatory. Develop antibiotic policies. Have review meetings every monthly, especially looking out for surveillances of hospital acquired infections. Usually we do that. No, what is the incidence of hospital acquired infections? Why is it caused? We go for root cause analysis and also come out with kappa measures. Okay, so then advise it for a deployment of resources, manpower and purchase of equipment, and also to establish infection control team which will be operating on job and looking out for any infections. Why is it caused? What is the gaps? What is that, to give any on job training? So these are some of the tasks of HICC. Infection control team are the ones who are on the ground. Okay, they are part of HICC. They will be the extended arm of HICC. We look into identifying the conducting the root cause analysis of hospital acquired infections, looking out for environmental problems of infection, and reporting community acquired infections in the hospital, taking up measures for nosocomial infection. And their responsibility also is to train the staff on infection control practices and monitor if there is any good program or good measures which are there, to see how effectively it is working, and also to see the oversee the occupational health program, to see whether all the people are being vaccinated, whether they have been adequately trained, whether they are using PPE. All these things are the responsibility of the hospital infection control team. So, as I was telling, you can healthcare case management committee for, even though you have HICC, you can also document your waste management committee separately, though it will be functioning together, which can have all the members of this hospital, from the head of the hospital, then all the members of heads of the different departments, infection control officer, radiation officer, nurse in charge, OT in charge,
ये गेट
hospital.
बंद करो।
Yes,
आपको बोल रही हूँ गेट बंद करो।
louder please. You have
सॉरी
some
मैम,
doubt?
सॉरी सॉरी।
There's some doubt?
नो मैम, नो मैम।
Okay, fine. And waste management officer who will be looking at the documentation process as well. What is this role of healthcare waste management? They should ensure that we have a top quality hospital waste management in healthcare institution. They evolve and formulate the hospital waste management policy and ratify it, and lay down the duties of the various officers of the healthcare waste management, and evaluate and monitor the effective waste management in hospitals, and have timely training program for categories of different categories of waste program of the workers. And this training should be documented, because this is one of the requirement for the legal requirement. So people have to show document if they ask for training of them. So they need to work along with the HICC, identify the training requirement, and conduct training program, and also responsible to ensure that good waste management practices are in place. So what are the parameters you need to monitor? Okay, the one is categories waste generated every month. You can see that more or less it will be same overall period. If there is something more, you must look into it, why is it happening, and take necessary actions. If there is really wastage of waste, or more generation is coming for some reasons. And financial aspects of healthcare waste management, you can look at what is the direct cost involved, what is the training cost of operating the maintenance of on-site. You may have the autoclave or hydroclave. What is the cost involved for maintaining these on-site treatment facility? And also they need to monitor for cost for CBW, because we need to pay for the CTF. You will all be wondering, why should we pay the CBWTF? They will also be generating waste, money from the plastic waste what we give. But you must remember that they are operating for us. Of course they'll be getting some money from, that is their business. But they are doing our responsibility on behalf of us. In fact, we call it what is called as polluters pay principle is there. That means those who pollute the environment, because we are the generator of waste, we are polluting the environment, so we need to pay for that. And that is one of the logic where we pay the amount to this common biomedical waste treatment facilities. Look at the public health aspects, like report injuries, needle stick injuries, and mechanism for that. And also any regulatory mechanism, if there is any objection from the authorities, try to correct it and report it. And training awareness has to be monitored. So waste audit, we have already told, to look at the quantum of waste, how is the waste moving, what is the status of the equipment, condition of clothing, incidence of sharp injuries. I'll skip waste audit because Suman has already discussed. Now, integrated infection control management. In this, we need to look at what is hospital acquired infection. Anybody can tell what is hospital acquired? How do we define hospital acquired infections?
मैम नहीं पता।
Yes.
patient who patient acquire infection after the admission of 2 days.
Correct.
If patient is getting infection from the hospital, then it's called hospital acquired
Correct.
infection.
Any infection acquired by the patient during the hospital stay, and usually after 48 hours, we call it as hospital acquired infection. Where could the sources of hospital acquired infection can be? It could be a case or a carrier, or it could be from improper sterilized instrument and dressing, or some improper procedure itself, fomites, or from vehicles like food, water, milk, blood, and blood products. Who are susceptible? The most susceptible ones are patients, of course, because they are already immunocompromised, so for some reasons. And next is the hospital staff, that is from doctors, nurses, healthcare auxiliaries, and hospital maintenance personnel. And also the visitors also who come can acquire some infection when they are here. And the most important, again, vulnerable population is our workers in working in the, who are directly handling the waste, who are directly transporting the waste, and who are involved in the waste disposal facilities. And also rat pickers, if they can pick up the infection. So, what is the principles of infection control? We have to have good practice, policies in place. Hand washing, I think now it's been very well implemented across the hospital. And what disinfectant to use for what purpose. And also patient admission, we can need have a hygienic environment, and monitor the infectious agent. You also do know, like you will be doing surveillance of OTs and wards for even the environmental pollution. That also we need to do. And waste reduction and reuse. So especially in special areas, we need to take further additional requirements, because they are very highly prone areas, and the susceptibility of patient getting HIA is very high. That is your OT, wards, blood banks, laboratories, okay, and places where there's sharp handling, and precautions, especially during transportation, spillage, accident reporting, and PEP. And what is PEP? Is post-exposure prophylaxis. Here, this is for if a person is having any stick injury or exposure, they need to take post-exposure prophylaxis so that this is available for HIV. For hepatitis B and HCV, we don't have much policy, but for HIV, definitely we have drugs in place. We need to take if there is thing. So this is indicated based on the type of exposure and type of injury. So this depends on amount of blood involved in the exposure, amount of virus in the patient blood at the time of exposure, whether it's HIV positive in the first place or not, and whether PEP was taken within the recommended time. Then only it will be affected. Usually, PEP has to be taken within how many hours? Within 24 hours, as early as possible, or maximum within 24 hours, it will be effective. 72 hours is the what they say. So what is to be done if there is an injury? I'll show you a video occupational injuries. There is needle stick injury which is good. You can look at it. Cut should be washed with running water and soap and water at least for 5 minutes, 5 to 10 minutes. And if there is any splashes to nose, mouth and skin, it has to be flushed with water. Eyes has to be irrigated with saline or clean water. And usually what we do, if there is some injury, we usually put our hands into the mouth. That should not be done. And we should not apply any antiseptics also. That is also not recommended. And report immediately to the immediate supervisor, whoever is there, and who will again report to the nodal officer of your hospital. And based on the exposure and the HIV status of the person, you need to initiate the treatment within the 72 hours. I don't know whether I should focus on this. You can read about this. It's there in your textbook also. Based on the exposure, whether you require, if there is no exposure, no PEP. If there is exposure, and especially if there is immune skin compromised percutaneous, you give code like EC1, EC2, EC3, and you need to indicate, you need to start this thing based on HIV status. So you have a the HIV status of a source we will not know. Sometimes we know it is positive, sometimes we know it is negative, sometimes we will not know. If there is some needle lying on the floor and if you get injury, you do not know from where the source is. If you are doing a operation on a HIV positive, you will know that is an HIV positive or HIV negative also. So based on the exposure and HIV status, we can decide whether PEP is required or not required. And there is two regimens which based on that they will recommend. So we always suggest don't worry about the regimen. For report to the nodal officer, they will take a decision based on the assessment of individual cases and decide whether PEP has to be given or not given. So these are the regimens which are available, and usually it has to be taken 4 weeks. So for this, the patient, I mean the injured person, whoever gets the needle, maybe the doctor, nurse, or the waste handlers, have to be properly counseled and then started the treatment, because they have to complete the treatment for at least 4 weeks. Now coming to the safety measures for waste handlers, these are some of the important measures which we need to identify, keep in mind for waste handlers. Hand washing facilities, PPE, that is personal protective equipment measures, precautionary measures, especially when there is invasive procedures, adequate training and awareness creation, good emergency measures if there is any needle stick injuries or any accidents, and safe transportation of waste, how should they take care of it, and finally safe disposal of infected waste. And they should be taught how to decontaminate water surfaces, work surfaces, specimens, and instruments. And avoidance of eating and drinking in hospital premises, especially where there is waste. And availability of immediate first aid measures should be ensured. And good housekeeping facilities, laundry facilities, and environmental conditions will help in protecting the health of the waste handlers. Next component is the disinfection and transportation. Transportation, I've already told you. For disinfection, you need to have written policy which drugs to be used, which disinfectants to be used in different things. You know there are so many methods. We have natural methods, chemical and physical. Natural, especially after laundry, you can sun dry it. Chemical, there are a lot of chemicals. We should decide which one to use, and especially for the waste which is going into yellow colored bins, we must not use chlorinated components. For others, we can use other things. Physical, we have hot air oven, dry and moist heat, incineration, autoclave, UV radiations. As appropriate as indicated, we will use those disinfection agents. Storage and transportation, I will skip. Now coming to the another important component is training and capacity. I think this will be handled by other faculty. Anyway, to broadly tell, uh, your capacity building training should be looking at one is to improve cognitive domain is the knowledge component, psychomotor domain is the skill component, and affective domain is their attitude towards this. I'll not go into the details. What we need to look at is based on the comprehension of the person. You must decide what type of methodology you will use, whether you want to improve the knowledge. For healthcare work, for waste handlers, you can just simply teach how to do the segregation by hand, or how to use the PPE you can demonstrate. Those are all psychomotor skills. Affective domain is one thing which is very tough, but we need to motivate people to follow this in the interest of their own and also the people around them. So training tools, you can use lecture methods, or you can use videos or demonstrations, or activity based learning. So use different technologies so that the people are interested and learn those things. Okay. Like last but not the least is the monitoring component in the administrative component. We need to keep this system monitoring. You can keep a baseline, then compliance, whether they're following on day to day, and also what has the impact. If you have introduced some system in your workplace, how has this improved your workplace working, that you can look at. And day to day monitoring is very important. As I told yesterday, if you do not monitor our even doctors also, you need to monitor sometimes, because they may not. Segregation is the key thing, especially the segregation thing has to be monitored on a day-to-day basis or periodic. Now, legal considerations. I think we discussed this already. Some of the important additional points I'll tell you. 5 years records we need to maintain. I've also told you the previous class on form ones, what are the forms we need to keep. Any doubts, you let me know. It's repetition, so I'm skipping, not repeating those. Okay, this I want to explain little bit. There are few principles, and think one is the Basel Convention at the international level. This prevents the transboundary transportation of waste. Okay, so if I USA cannot dump their waste and send it across to uh, India or somewhere else, some poor countries. Okay, they should not do. This is the convention which regulates the transboundary movement of the waste. Next, polluter pay principle. This principle I told you, like those who pollute the environment are bound to pay for that, and that is the one of the simple basis to pay for the common treatment facility. Next is the precautionary principle. What is this precautionary principle? If you know some waste, you will take precautions. If you know the nature of the injury, or nature of the uh, chemical or whatever. Sometimes you do not know some of the chemicals or some of the equipments, what is it going to cost to us. Okay, in that time you must exert have more caution and do it precautionary. You assume that it could cause some major thing and take all the precautionary so that it doesn't harm us. So you can be extra cautious and take it. And duty of care principle, we must all do the duty such that it is taken care very well, and we responsibly dispose our waste properly. Next is the proximity principle. Again, this also underlies the importance of segregating at point of generation, or treating the waste as close to you possible. And this is also prevents us from transporting our waste to farther places to manage our waste. So it tells that you must manage your waste as close to as your point of generation. Okay. So let's skip this. So to end, essentials of biomedical management, I'll come to this roles and responsibility, which is important. So what are we have each, as I told, there are many people, all multiple players are there in our institutions who are important for our waste management. One is the head of the establishment, because they are important, because each responsibility lies with uh, forming a waste management team, designating a waste management officer, or forming a committee, allocate financial resources for manpower, either it could be for training or for the consumables like your bins and trolleys and those things, or PPE, and ensure that monitoring procedures are carried out and ensure safety of all the staff and also training and vaccination of the key staff members. Waste management officer, what is his responsibility? He look at whether the waste collection is happening properly in the internally, whether it's adequately stored, and also coordinate with the cbwt and see to that the waste is timely collected and disposed properly. See, it's not that we hand over our waste and our responsibility is done. In fact, the rule says we can visit the CBWT, see to that our waste is responsibly handled. So we are just their proxy for our management. So our responsibility is not that give it and it's their responsibility. I don't have nothing to do that. If they are not doing proper, it's our responsibility to see to that we they to do it properly or report to the pollution control board. And also the management officer can liaison with department heads and ensure training is carried out and monitor periodically the waste generation, disposal, cost, and public health aspects. What is the role response to other officers? Senior nursing officer, infection control, they can contribute by training and implementation of correct procedures. Nurses especially play a very important role, I feel, in biomedical waste because they are on site and they can keep a watch even on the nurses, doctors, or the class 4 employees, everyone. They can direct them to do it properly. Chief pharmacist radiation officer, they have to take care of especially of their radiation thing and all the drugs. Hospital engineers is responsible to look at the facility, storage facility has to look at, or autoclave whether it's functioning properly and monitored properly. Those things is engineering responsibility. So to summarize again, I'll come to this slide saying that all of these components have to be taken care of, keeping in mind your administrative and legal aspects. Okay, thank you. Any questions? I'll play another video, occupational safety, with that we will close. One
Occupational
minute.
safety. Healthcare personnel and workers
Is it audible?
handling waste may encounter hazards and infection risks as a
Yes, ma'am.
result of their
Yeah.
occupation. It is therefore necessary to prevent and control these risks. All healthcare facilities have a responsibility to ensure the occupational safety of healthcare personnel. An occupational safety program should include provision of personal protective equipment, regular health checkup of all healthcare workers, immunization, management of accidental exposure to blood and body fluids, training, and documentation. Personal protective equipment. Personal protective equipment are specialized clothing or equipment which act as barriers against infectious materials. It should be made available to all personnel who collect or handle waste. The following are to be used by all those who handle biomedical waste: cap or head cover, mask, goggles or face shield, gown, gumboots, and heavy duty gloves. Regular health checkups. According to Biomedical Waste Management Rules 2016, all healthcare personnel, including waste handlers, must be provided a medical checkup at the time of induction and thereafter once a year. Immunization. All healthcare personnel should be immunized with hepatitis B vaccine and tetanus toxoid. Management of accidental exposure to blood and body fluids. Remember, recapping is a wrong practice. It can lead to needle stick injuries. Occupational exposures to blood and body fluids can also occur through spills and splashes into the eye or mouth. When such an occupational injury occurs, do not panic. Do not put the finger into your mouth. Do not squeeze the blood from the pricked finger. Do not apply any disinfectant. What you should do is Remove gloves and place hands under running water for 5 minutes. Collect blood from the source and the exposed person and send it to the lab for HIV and hepatitis B testing. Record details of the event and its follow-up in the injury register maintained at the hospital. Start post-exposure prophylaxis for HIV preferably within 2 hours and not later than 72 hours. The exposed person must also be provided with psychological support by a counselor. Training. All healthcare personnel and waste handlers should be trained on biomedical waste management on an annual basis.
Any questions here? Shall I play on-site pre-treatment which I have?
Yes, ma'am.
These are all small videos. You can use it for your training as well.
On-site pre-treatment. Mismanagement of biomedical waste. On-site pre-treatment. Mismanagement of biomedical waste can transmit infections. Transmission of infections through procedures in the hospital can be prevented by sterilization of instruments used and disinfection of the surfaces. Biomedical Waste Management Rules 2016 recommends microbiological waste, biotechnology waste, and other clinical laboratory waste, including blood bags, to be pre-treated with non-fluorinated chemical disinfectant or autoclave, microwave, or hydroclave. The surfaces that have come in contact with blood or body fluids have to be disinfected with sodium hypochlorite. Healthcare facilities which do not have access to common biomedical waste treatment facility need to follow on-site disinfection processes for recyclable plastic waste, glass waste, and shelf waste. Plastic and glass waste needs to be disinfected by autoclave, microwave, or by chemical disinfection and then sent to registered recycler. Sharp waste should be disinfected using sodium hypochlorite and then disposed into sharp spit.
Okay, one more video. Uh, do you want a video on blood spill management? I have time, so I'm playing with this.
Ma'am, please play.
Blood spill management.
Blood and body fluid spill management. Blood blood and body fluid
1 minute.
blood and body fluid spill management. Blood and body fluid blood and body fluid spill management. Blood and body fluid spills need to be managed with utmost care to prevent body fluid spill management. Blood and body fluid spills need to be managed with utmost care to prevent exposure to infection. Every nursing station must contain a spill kit. The spill kit should contain disposable apron, gloves, mask, absorbent material, disinfectant, mop, yellow and red plastic bag. In an event of spill, the following steps need to be followed. Step 1. Cordon the area and place a caution board. Step 2. Open the spill kit and wear the personal protective gear. Step 3. Cover and clean the spill with a paper towel or any absorbent material and discard in the yellow bag. Repeat the process if necessary. Step 4. Cover the spill area with sodium hypochlorite and wait for at least 20 minutes. Step 5. Wipe the area with paper towels and dispose them into the yellow plastic bag. Step 6. Clean and mop the area as per regular housekeeping practices. Step 7. Remove the personal protective equipment and dispose it appropriately. Step 8. Wash your hands. Finally, refill the spill kit for the next use.
Okay, any questions? No questions. I think we're done with our topic today. You have another session after this, my class?
No, ma'am, only discuss.
Can I have introduction of other participants? Seema Pal from which place? Pramod and Dr. Virendra Chahal from which place? Okay, I think we'll close the session. I think I finished a little bit earlier only. Thank you, everybody.
Thank you, ma'am.